fixing it. So what we do is we shift this back over and then put a plate with some screws in there that repairs that back or fixes the bone back to where it should be. The risk you get into is when the ball is not sitting where it needs to, the blood supply to that ball will sometimes be compromised. And over time, you might develop, it's called an osteonecrosis, or the bleeding or the bone, which gets its blood supply from the neck area, will sometimes not be there, and it'll cause that to disintegrate and go away. Plus, your function's going to be really compromised with this afterwards. It'll heal, but I don't know how much you'll get out of your hand afterwards as far as being able to use it up above and move it around. So by going in and fixing it, it's obviously a surgery, but the downside is we would probably want to get you off the Xarelto for a few days beforehand just to minimize that risk. But then also probably need to go back onto it once we're done with the surgery. And then essentially we should be able to get this so that it doesn't hurt you so much. Every time you move now, you're probably feeling it, which is quite uncomfortable.
Yeah,
so
exactly.
these Michigan roads and the potholes probably didn't help you the whole way down here.
That's right.
Normally, once you get this stabilized with the plate and screws in there, your pain will be significantly better. The second downside of the surgery is this is going to give you a stiff shoulder. So it's going to require physical therapy afterwards to get your range of motion and your strength back as best you can. So you definitely have to do that. And normally we need about 3 weeks of the sling and rest afterwards to let things calm down. But then it should be safe to start moving it after that.
Resting sounds like a substitute.
Well, I think that's probably in your best interest. Are you right or left-handed?
I'm right-handed.
Okay.
So
pretty active?
Yeah.
Still up and around doing stuff? And taking care of, I don't know, do you live by yourself or do you?
No, I have a husband. He just finished with cancer treatment.
Oh, boy.
Yeah, it's okay.
He's going to have surgery for his artery leg this Friday, so we're
so
full
here we
scale
are.
nursing home right now.
Okay.
Mostly
Sorry.
86, I said, oh, what happened to us?
Yeah, unfortunately, that's normally the way it happens.
Yeah.
You start to suffer too many problems as you get older.
Very, very painful.
So for you, if you're trying to get flat in bed, you're not going to like it right now. So if you have a lazy boy, that would make your life a little easier as far as just comfort. Sleeping in that upright position will definitely be easier and less painful for you, and then you won't have to struggle to get up as much.
Okay,
But
we have a couple chairs.
yeah, so try to use that now. Ice on this shoulder as much as you can for the next couple of days through the weekend. What we were looking at, we looked at the schedule, and we think if we can get it on the schedule and done, we can maybe do it next Tuesday for you.
Oh, it'd be wonderful.
So I know it'll be a long weekend, but it's too risky with the Xarelto. We need you to be off of that for a good couple of days, 3 to 4 days. And Monday I'm booked, but Tuesday we can put it on. And what I'd probably do, it's going to be later in the day, is we just keep her overnight so that you guys aren't having to rush back, have to try to get home and get out of there by dinner time. It just doesn't make sense. So we'll do it in the afternoon and just keep you overnight, make sure you're comfortable, and then you can go home the next day. Oh, yeah.
Surgery.
Yep.
Okay.
Yep.
Yeah, that's what we need. I guess we need.
Any other medical problems?
Yeah, she's really healthy.
Pretty healthy?
Yeah.
Okay. So you're just on a blood pressure medicine?
Yeah.
Okay. Questions that you have?
Well, it doesn't sound like that would go back to completely the same as it was before, but it's going to be a heck of a lot better.
I agree. That's accurate. So yes, you're going to have some stiffness and stuff to work through, and sometimes you can't get all the way up, but I want you to be up here so you can get to your head and get to your back.
Do I have to use this?
You don't have to, but it usually is helpful right now. Keep you somewhat comfortable for a little bit.
Until, this afternoon, we're riding over and I got tender as can be, I'm just going like that and I can feel it.
Yeah, again, I think what happens is all the potholes, the bone is in there just banging around, and because it's loose, it's not together.
Yeah,
So you're gonna feel that. So unfortunately, you're gonna have a rough afternoon. When you get home, pack it in ice.
okay, all right.
Did he give you his ice unit?
No.
No, he said it's available to.
Call him back and have him bring the ice unit over to you.
Okay.
So there's a pad that can sit on your arm and shoulder here, and
Okay.
it fits into a cooler that just circulates it with a little motor.
Oh, okay.
That'll really help you with the discomfort. So you
Okay.
can use regular ice bags, but they melt every 15 or 20
Yeah,
minutes.
yeah,
This you
right.
can fill up and it's good for a couple hours.
Oh, that's good.
And then again, that lazy boy position is just gonna be so much easier for you.
Good,
So don't try to get flat in bed because you won't like that either.
yeah, well, so it's just kind of loose in there.
Yep.
Oh.
You know?
He sometimes likes to have the swing off.
Yeah, that's fine. Yeah.
Yeah, I think if I.
And with
right
all this
now-
swelling, the other thing you can sometimes do is put a little ace wrap on, but it's not too bad. So the discoloration looks scarier than it really is.
Now, can I take this off or?
Yeah, you can take it off. I'm just checking your pulses.
Yeah,
You can take it off, but again, I would probably tend to leave it on as much as you can. And watch, don't adjust so that your leg and stuff is moving your arm up any.
oh.
Or don't lean forward because you're forcing this together is what you end up doing with it. So you gotta be careful with how much pressure you're putting on the elbow area.
Does she have the sling fitted right now?
Yeah, there's not gonna be a whole lot you can do under the circumstances, so it's sitting back there pretty good.
Okay.
And this, I would just come over here a little bit more.
Mm.
But
And you sleep on my back.
sleep in the chair.
Okay, all right, okay.
Yeah, literally, the least you can get flat, the better it's gonna be for you.
Okay.
Sometimes the guidance was to lay flat with your arm up, keep your arm up, but
Yeah.
she was so uncomfortable.
Yeah, doesn't work well. So get into the chair, pack it with pillows or blankets or whatever you gotta do to get the arm in a comfortable spot, and if you wanna loosen the sling, that's fine. But that, just semi-reclined position is gonna be a lot less painful for you and be easier for you to sleep.
Oh, okay, that sounds good.
Yeah.
And Dr. Cutter is my primary doctor, and he said, whatever he tells you to do, do it.
We met with him yesterday, he said just whatever
Yeah.
you say or order that he'll support, so.
Yeah, right.
He's been our doctor for like 30-some years.
Yeah.
All right, I'm gonna get a quick list of